The town of Berlin. Country charm at the center of Connecticut.
I think so. Okay, welcome everybody to the Berlin Town Council meeting. Call this meeting to order and start with the Pledge of Allegiance. Pledge of Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Roll call.
Councilor Angela Constantson. Here. Councilor Danielli.
Here.
Councilor Giannoni. Mayor Kaczynski.
Here.
Councilor Luddy.
Here.
Councilor Pat. I had it all day long.
Here.
Pagliaro.
Here.
And Councilor Pagliaro, I will have your name down, and by the next meeting, Councilor Pagliaro, because I've been saying it all day, Councilor Pagliaro.
Okay.
Okay, and thank you for your
Okay.
patience with me, Councilor Pagliaro.
I said just call me Karen.
Councilor Walker.
Hey. It's an easy one.
Thank you. Oh, you have a quorum there.
I think you're too hard on yourself, Kate.
I think
Don't
that's
beat
what
yourself up. Yeah,
Yeah,
you're
thank you.
too nervous over it. Okay, thank you. We start with our audience of citizens. Do we have any members of the public that wish to address the council tonight? Now would be your time. I see no hands raised, so with that in mind, we will close the audience of citizens. And before I move on to our meeting agenda, just one certificate of appreciation I wanted to read. This was in recognition of Berlin's 2017-2018 annual contribution and continued support of the Connecticut River Coastal Conservation District technical and educational services and programs. Berlin's contribution will help the district maintain the level of service our municipalities depend on to balance land use needs with protection of natural resources and address natural resource concerns. So we have a certificate of appreciation presented to the town of Berlin, given in recognition of our contribution for the 2017-2018 fiscal year by the Connecticut River Coastal Conservation District. So thanks for that recognition from them. And now we will move into our meeting agenda, starting with our consent agenda. We have three items there.
First thing I want to do, Mr. Mayor, is make a motion to remove topic number 3 and put that into the regular agenda. Make that agenda item 1A. I think a couple councilors have some questions.
Okay. Do we have a second on that?
A second.
All right. All those in favor?
Aye.
Aye. All right, so we'll move it there and we'll discuss it there. So we have our other two
Okay.
consent.
I'll make a motion to accept the remaining 2 items in the consent agenda.
Second.
Second.
All those in favor?
Aye.
Aye.
Opposed? So moved. So now we will go to our we have a public hearing tonight. So we will public at 7:05. So pursuant to section 7163E of the Connecticut General Statutes, a public hearing of the Berlin Town Council will be held on Tuesday, December 19th, 2017 in Town Council Chambers, Berlin Town Hall, 240 Kensington Road, Berlin, Connecticut, 7:05 p.m. concerning the granting of a drainage easement to the property located at 76 Fuller Way, owned by Big A LLC. So that is the purpose of our hearing, as well as the call to order now the legal notice. Kate, I guess I just read the legal notice, huh?
You did it again.
Okay. So that is our purpose. We now will take public comments, if there's any public comments on this particular hearing, this easement that we're looking at granting. Any public comments during this public hearing? In favor of? Sure, that's one. That's a comment, sure. Actually, you probably need to put that, right? You need to just come forward and just put that on the record, name and address. Sorry about that. Happy to take it, though.
Thank you. I am Frank Giarratano, the CFO for the Big A LLC. The drainage easement has been in use probably for the last 10 or 15 years. We would just like to get it recorded for bank financing purposes.
Okay.
Excuse my tone.
Is that right?
From a cold like everybody else.
That's all right. Appreciate it. Thanks.
Just to add briefly, Chris
Yeah.
Edge, Economic Development Director. This is actually with Premier Limousine, who's actually one of our more well-known and higher employing companies. A good thing about Premier Limo is every time their cars go out, it says Berlin CT on the side. So just one of our favorite people, and just ask that you support this.
Okay.
That's great. Thank you. Okay, any other public comments? Any other comments? Hearing none, I'll close that portion of the hearing, and now we go to town council comments. Any town council comments on this public hearing? Hearing none, I will close the public hearing at 7:08, I guess, p.m. And now we can, we'll vote on that during our new business after.
Correct.
So now we're at
Charlie Brown.
1A, right?
No, well,
Oh, new business?
we'll have the presentation and then we'll do
Oh, okay, we'll do that first,
1A
yeah.
is after one.
Okay. All right, so we have our annual presentation. Charles, welcome. Glad to see you guys. We will move out of the way so we can...
I don't think you have to.
Oh, we don't?
Our annual presentation with issues with the computers in.
Okay.
As usual.
Oh, is that right? Oh, okay, all right.
We've got
Okay.
handouts here.
So we are moving?
No,
You were staying.
we don't have to move. All right, we don't have to move. There you go.
So we're not
Let's
doing
walk in for you, right, Peter? Yeah.
Unfortunately, we do have a
Yeah.
PowerPoint presentation, which we
Yeah.
will share with the town, but because of technical difficulties, we can't show it. So
Okay.
you do have the presentation in front of
Yeah.
each one of you.
Yes, we do. We do.
Okay. I'm just going to start first. I'm Judy Sartucci. I'm the chairman of the Board of Health, and I'm
Welcome,
very
Judy.
pleased to be here this evening. I want to, first of all, congratulate each of you on your elections and your re-elections. We look forward to continued work with your administration. And we do want to, thank you for your time this evening as well. I'm one of the three representatives from the town of Rocky Hill that are on the board. You also have three representatives here from Berlin. I just want to introduce two of them that are with us tonight. The first is Dr. Patricia Checco and Ray Drama. Both are longtime residents of Berlin and probably need no further introduction there. The third appointee that you have on the board is Carolyn Wysocki, and she's unable to be with us this evening and sends her regards. And actually, Carolyn is probably our longest current sitting member of the board, which goes back to 1998 when Berlin first joined the health district. She's been your representative, one of your representatives on the board since then. On there, I'm just going to talk for a moment about the board a little bit, and then I'd like to reintroduce Charles Brown, who's our Director of Health here. The health district was formed in 1996 by the towns of Rocky Hill and Wethersfield. Berlin joined in 1998, and in 2006, Newington applied and was accepted for membership. So we've got 4 towns that the health district has been serving for. We're really in our 21st year now of service, to our 4-member towns. The board, it's governed, we're what they call a quasi-official agency. In other words, and we're set up by a special law under state statute. So in some ways, we're like a private not-for-profit in the sense that we're an independent agency from any of the 4-member towns. But at the same time, we've been empowered by state law and by our member towns to carry out a municipal function, which is a lot of the public health and safety component, which Charlie will be reporting on this evening on behalf of our towns and such. The board is a full governing board. It Besides appointees from each of the town, we also have our Director of Health on the board, who's appointed to a 3-year term by the board members. The board is responsible for the oversight of all the issues in the planning for the health district. And in addition, setting the direction for the health district, establishing the budget. We are responsible for the local ordinances related to public health that we develop. We do have our own local environmental health code that, again, Charlie will be touching on a little bit later, and such. And we're responsible for setting the budget and, as I said, and for oversight of the financial affairs. And we've had a very talented board. We've been very fortunate in the health district. I know a lot of boards and commissions, the towns very often have difficulty getting appointees and then keeping appointees and such, but we've been very fortunate, and especially here in Berlin, you've been very fortunate that you've got some very good and very talented members that have been there, as we found with all the towns, and that are very active on our board as well. Next, I wanted to just kind of reintroduce Charles Brown, because I know a number of you are new on the council and may have not met Charlie before. Charlie has been our Director of Health for the last 3 years, and he was really recently reappointed to another 3-year term. He's a native of Florida. He served in the Air Force for 8 years with assignments in Kuwait during the latter part of the Gulf War, and also assignments in Bosnia and Somalia. Charles worked first as a environmental compliance officer for the couple of counties in Florida before moving to Connecticut. He holds a degree in communications from Central Connecticut State University and a master's degree in public health from the University of Connecticut School of Medicine. He previously had worked for 12 years for the Connecticut Association of Directors of Health, which is a large membership organization for all the directors of health and health departments and districts in the state. And most recently had been his executive director before his appointment as our Director of Health in 2014. We're really pleased to have him on the board. He's came on board at a really critical time for the agency, and he's done a lot to engage people and organizations and such in our 4 towns, as well as working with the hospitals, medical providers, and a whole variety of community groups on a lot of the important health planning for our member towns. And he also, by law, serves not only as a member of the board, but as our secretary treasurer and as the board's chief executive officer. So he has a lot of hats that he wears, at any one time. In terms of the presentation we were going to do this evening, as Charles said, you do have a handout in front of you. Just a couple of other comments about the health district, and then Charlie will go into its programs. Besides serving the 4 towns, it's really a combination of about 98,000 that we serve all together. And as a health district, we provide a broad range of public health services. We're one of 20 regional health departments in the state. We have about 72 or 74 health departments, 20 of which are regional health departments, like the Central Connecticut Health District of which you belong. And we've found this, the towns have found this a very effective model in terms of sharing services. It helps both in terms of the kinds of services that we can provide, as well as helping the towns in terms of keeping down costs. Charlie has 12 employees, 9 full-time and 3 part-time, that work out of 5 offices. We have a sanitarian in each of the town halls currently, some community health staff that work out of the Senior and Disabled Center in Newington. The bulk of the staff in headquarters are out of rented space that we currently have at the Weathersfield Town Hall. Charlie will go through the revenue a little bit with you there, and also we'll talk a bit more about public health and what we do. I did want you to be aware that besides the staffing that we have, we've been very fortunate as a health district, and this has been a little unusual in the state in terms of the numbers of professional and lay volunteers that we have that help with a whole variety of programs. Besides its governing board, which is all volunteer, appointed for 3 years. We're not compensated for what we do. We really do it as a service to our member towns with our appointments. We also, our volunteers also help in terms of running our large flu clinics, as well as contributing time to some of our other public health programs, which you'll see Charlie will point out there. So we've been very, very fortunate having about 50 active professional lay volunteers here, which really have helped to really make a difference in terms of what we're able to provide to you. And then we'll be glad after Charlie's presentation to answer any questions that you might have. So thank you.
Thank
again.
you.
Thank you.
Thank you, Judy. So when I get up here, it's basically to start talking about the bottom line. So in our last fiscal year, in the 16-17 fiscal year, just as a bit of a recap, we had a little bit over $1 million in total revenue for the health district. The majority of our revenue, or as far as single source of our revenue, does come from our town per capita allotment. And the town contributions during that year were at $5.25 per person, which is probably one of the best deals you'll find per year, and it totaled to $513,634. We also get program revenue. This is revenue from sources like our flu clinics, where we actually get billed for services, and then the license fees that we have for our regulated community. In addition to that, one of the major sources of revenue that we have is grants, both federal, state, and other sources for grants that total about $314,000, and a little bit of interest income thrown in there. Our expenditures for 2016-2017 were $1,186,314. Most of our expenditures, as you'll find with most service agencies, really do come with salaries and benefits. We don't make widgets, so the cost inputs really aren't there. So, we do have some of our expenditures for professional and contracts, and then programming and operating expenses at about $119,000. But as I mentioned, most of our money really goes into the expertise of our staff and making sure that we have the appropriate mix to be able to deal with the issues that we have. Just wanted to go over just a little bit about the difference between healthcare and public health. So a lot of people, when they hear health, they think white jacket, stethoscope, and that's where it comes from. But public health takes a little different perspective. So the primary focus for a healthcare situation for a doctor is really on the individual. It's a one-to-one type of relationship. Where public health, we really look at the population as a whole as our patient. The interventions that a healthcare professional would have, they would diagnose your illness, and then they would figure out how they're going to treat it. In public health, we're similar in that we assess the community and the health of the community. We really look at developing policies to address what may be wrong, and then we assure that those policies are followed out so that it will actually deal with the intervention piece of it. The process within healthcare really looks at the management of patient care, where in public health we really look at systems management, how we deal with the environment, how we deal with human behavior to really address the process of how we go through this. The outcome for healthcare really looks at returning the individual to health, where in public health we really want to ensure that we have a healthy community and we improve the health of the community as we move forward. So I'll give you a little example how healthcare addresses influenza. For a healthcare response, they really look at screening the individual for risk. They may teach them how to prevent, and then they'll make sure they give that really annual flu shot. If they do get sick, they'll provide the individual with Tamiflu. They'll treat any other meds if they're infected, and then they'll treat any other conditions that they have. For example, if they have pneumonia secondary to their flu infection. At the end of the line, they'll report the fact that you got that disease up to the state health department. From a public health response, it's similar but a little different. we monitor and track seasonal occurrence of flu as a whole within the community. We use public information campaigns to really get out there about things that people can do to really address the flu. We do targeted or mass vaccination flu clinics to try to increase the herd immunity within the community so that flu bugs really can't find a hold within the community to really start to spread. And then we promote policies such as employer-required vaccination for healthcare workers so that we can protect those people who can't get the vaccine, those vulnerable populations that may come into encounter with the healthcare. Overall, the purpose of a public health agency really is, 7 things, and I'll go through these really quickly for you. We want to prevent epidemics and the spread of disease. We want to protect against environmental hazards. We want to prevent injuries, promote and encourage healthy behaviors, respond to disasters and assist communities in their recovery from those, and to assure the quality and accessibility of health services. And it's not as easy as being able to walk into the pharmacy and saying, you know what, I want an ounce of prevention. So I'm going to go through and just give you some examples of how our services in this past year really address those 7 things, okay? So preventing epidemics and the spread of disease. Influenza, we're right in the middle of flu season right now, and I think most people have seen in the news that we're actually in widespread flu season in Connecticut right now. Last year we gave over 2,000 flu shots in our 8 mass vaccination clinics that we have within the 4 towns. The average time if somebody walks in with a pre-filled form is 3 minutes from when they walk in the door with their form to walking out the door with their shot already taken care of. And I'll go into some detail as to why that is. So you can't walk into CVS and get it done in 3 minutes, I'll tell you that much. The other things that we do with respect to the spread of disease is really look at disease follow-up. So we actually look at the levels of disease within our community. We follow up on specific reportable diseases. And one of the main things that we've been looking at here in the last few years is the rise of hepatitis C within our communities. Because that's really mirrored kind of the rise that we've seen in opioid addiction and in intravenous drug use. Okay. One of the other things that we see with spread of disease every year is the mosquito-borne diseases. Last year, the big disease that everybody was talking about was Zika and the Zika virus. And we're lucky here in Connecticut because we don't have the type of mosquito in our area that really can carry the Zika virus. But that doesn't mean that Zika does not affect our citizens, because our citizens travel to a lot of those sunny places and tropical warm places, especially at this time of the year, where Zika is endemic. So we actually do work with the State Department of Health to really make sure that the information for both the providers and the patients get out there on what they can do to protect themselves and their families if they do happen to be contact Zika. In addition to that, we always are keeping our eyes out for West Nile virus and Eastern equine encephalitis to ensure that if there are cases that we follow up with that, and we do report on those as well. One of the main things that we do throughout the year, and it's foundational for public health, is protecting against environmental hazards. Our environmental sanitarians, and we have 5 sanitarians in our office, last year they conducted 1,886 food service, temporary events, septic, pool, and salon inspections. In addition to that, they've done a lot of outreach and training. Here in Berlin, they've actually gone to the high school. They've done training on what food inspection and the purpose of that and why enforcement is so important. And they really look to be able to be out there every day. I can't say enough about our environmental health staff because they really are the foundation of ensuring that all of our staff, our communities are protected on a day-to-day basis. Some of the other things that environmental health gets into is responding to complaints. And last year we actually responded to 220 complaints relating to health and safety. We've worked a lot of times with the state's attorney's office, the Connecticut Department of Public Health, to really address a lot of complex issues, like hoarding cases and things of that nature. Another issue that we deal with environmental hazards is lead poisoning prevention. And we do a lot of outreach to rental property owners and renters. But we do want to point out that it's not just peeling paint that people have to be aware of with respect to lead poisoning prevention. There are a lot of things that we found, especially here in the last couple of years, where jewelry from other countries, toys, cookware that you wouldn't expect were lead to be. So we actually work, when we find a lead poisoned child, work as a team with our community health and environmental health staff to investigate this and really try to eliminate the hazard so that we can bring that blood lead level down to bring that child back to a safe level. Radon, we do a lot of public education around radon. We also provide testing kits for people that want to test their home. Radon is one of those things that people don't really think about very much, but it is something that if you can determine that the levels are beyond what they need to be, that you can mitigate that within the house. Environmental hazards, also dealing with asthma. We do have a Putting on Airs program, and really the focus of this program is to prevent emergency visits, specifically focusing on children as the target population, but it does get into adults. And we do home visits with asthma patients and their families, actually going out there using a team approach to highlight the triggers within their environment. So they go through the home, they look at it to make sure that there's environmental triggers, and they also go through the medications that the patients may get. Because a lot of times people will go to the emergency room, they have a variety of medications, and they don't have the time to go through to make sure that they have the proper equipment, that they're using the medication properly to be able to manage their conditions. Preventing injuries is another main thing that we do. We sell bike helmets, and it's probably one of the best Christmas presents you can get because we sell them for $10 a piece. So if you're looking at Santa Claus bringing you an actual bicycle or even a new sled, helmet is a good idea, and y'all can come to our main office in Wethersfield, and we sell them for $10 a piece. One of the best deals you'll find out there. We also have been spending a lot of time recently on social media, giving Facebook reminders about things like recalled products, making sure that people understand the risk of food handling, especially around the holidays. So we do a lot of that, and we'll continue to do that. One thing that we have done, and I will say Berlin has been the shining star within our 4 towns over the past few years, to promote and encourage healthy behaviors, has been our walking competition. So we've had a walking competition between Berlin and Rocky Hill is how it started between the employees. And then it actually blossomed from there. When I got here, we expanded it to all 4 towns, and all 4 town employees were doing it, and Berlin won every time. So we tried to figure out how can we get Berlin to get some competition here. So we expanded it into all the public. So anybody from all of our communities, and Berlin has won the 2 years going since we've opened it to the public. So be proud of your community because you folks are definitely active, and that's what we want to see. Last year we did institute an impact award, and Wethersfield actually won that because while you had the most miles walked, Wethersfield had the most people involved. And really that's what we want to see. We want to see more people in the community being active. So hopefully maybe next year y'all can step up your game even a little bit more and try to get the highest participation within the communities as well.
And we have the best walking trails in the 4 towns.
See,
Yes.
somebody is proud of that.
So we should phone a friend.
So phone a friend. Coming up here in April, make sure that you get out there and walk and be part of the competition. It's really important. So as we encourage healthy behaviors, one of the things that we have, and I gave to all of you, was a copy of our Living Healthy in the District guide. So this little guide, which is on our website, and we have in all of our offices, provides a lot of information about our services and things that you can find in the town, from farmers markets to trails to mental health and substance abuse resources if you're looking for those things as well. So we've had we update that guide probably at least once or twice, every 1 or 2 years. And it just recently got updated in September. Yeah. Another thing that we do is we actually have training sessions for the public. And in the last holiday season, we actually did training sessions on how people can actually make sure that at large family gatherings that they're taking care of their food safely, that they're handling their food safety so that you're not sending people home with the gift of food poisoning. So we had those sessions out there. We're going to continue to develop sessions along those lines to be able to encourage healthy behaviors. as Judy mentioned, one of the things that we do to respond to disasters and assist communities in recovery is really our emergency preparedness planning. We do flu clinics, and I mentioned how fast people go through there. Well, there's a reason why they go through so fast. We use our flu clinics as a test for how we actually prepare if we had a pandemic and we had to vaccinate, all of our community against a particular pathogen. So we look at this for medical countermeasure dispensing, and we couldn't do it without that cadre of volunteers that Judy mentioned, both professional and lay volunteers that actually help us to set up the clinics and are trained in how they do this. So every year we get a little better, we make our plans a little better. And that's critical. Looking at assuring the quality of accessibility of health services, one of the main things that we do, and I think is a really important thing, is we actually do dental screenings for seniors. So we provide free oral health screenings and referrals for seniors in all 4 of our towns. Last year we served 88 clients, and we're looking to be able to up that number as we move into the coming year. We do have a grant to support that from the North Central Area Agency on Aging. I always mess up that acronym. NCAAA. And they have helped us to be able to provide more resources to be able to do that. It is so important to take care of oral health, especially as we get older, because we find that direct correlation between the health in the mouth, between overall health. I'm getting close to the end, folks. So one of the things I do want to highlight, though, was last year we did take a big step towards how we respond to the opioid crisis. I think everybody recognizes that opioid is a major public health concern. And we've been serving as convener for all of our local response agencies in all of our 4 towns. We've been into public awareness forums in many of the towns, but we actually convened and held 2 stakeholder forums in both April and November of 2017. And really what we tried to do was to bring together all those people who have a stake in the game and try to figure out what we can do. Our focus has really been on action, where at the end of a lot of these public awareness things, you feel really good, but then people go away and nothing happens. So we've really tried to get together all the folks to be able to see how we can address and do something about this problem. Currently, we have work groups that are addressing things like prevention, response, treatment, and recovery. And the work that our folks have been doing has really been driving some of the highlight at a statewide level. So they're looking at things like, how can we define what a recovery-friendly community looks like? So those conversations and policies that you make as a town and a town council really affects how an individual who's trying to recover really comes in within the community.
And you might want to add that, Mr. Mayor, we may be coming to talk to you about looking for local champions.
Great.
Okay.
Good. Look forward to it.
So let me talk about going forward. We are looking, as Judy had mentioned, we have 5 separate offices for our agency, and we are looking at consolidating those offices. We've talked about this for probably as long as I've been coming to these meetings. But we are actually looking at consolidating our office staff and our functions into one site in late 2018. So we are going to make that move here late 2018. We continue to work on our administrative and health policies, including revising the health district code. We have a big change coming up this year in that the state adopted the FDA food code. So we have to change our code to reflect that. And it's going to be a lot of working together with our food service operators and our inspectors to make sure that everybody understands the code, make sure that they're applying it correctly, and that there's no hiccups as we go through. In addition, we continue to work on the pieces for National Public Health Accreditation, and to get that in place as we're moving forward as an agency. My last 2 words are thank you. Thank you to all of our member towns, to you as a council, and the public for your continued support of our agency. And we stand ready to answer any questions.
Great. Thanks, Charles. I mean, thank you for all your work, and we appreciate you keeping our community safe. public health standard. I just have one question on the opioid crisis, just the latest. I mean, you read it in the newspaper, but not up, down in Connecticut, stable. We've seen it any success. The usage is up. Still?
Let me put it this way. In last year, for the entire year of 2017, we had within our 4 towns 13 deaths all told.
Okay.
In the first 6 months of, or it was 2016 rather, in the first 6 months of 2017, we had 18 deaths within our 4 towns. So we're just closing out the year, so we already know that we're going to be increase in morbidity, or mortality rather. And we're assuming, morbidity too probably.
Yeah.
So unfortunately, I mean,
Not good.
we haven't seen the numbers starting to turn down there. And
Right.
that's one of the reasons why I think our focus and our charge really has been on action. Because I think everybody knows by now that we have an issue. It's just, what are we going to do to start to curtail those numbers? I think naloxone and Narcan has done a lot and will continue to do a lot in bringing,
The police chief's been a great support.
right, and bringing people back. But the things that are going to keep the long-term issues done are how we deal with people that have gone through the addiction cycle and are at the point of recovery. And I think that a lot of the work that we're going to do in the future is really, how do we address that growing population that's going to be in recovery for a very long time? Pat?
If I may, I think it's really important.
Excuse me, Dr.
Oh, okay.
It's good to have good board members.
As with so many other things in health, we like to put the focus on the prevention piece, even though we only spend 3 cents on the dollar for prevention. So that if we're talking about tobacco, it's, well, let's put the money into keeping people from starting. Let's get those kids, although it doesn't work. And even with opiates, I think there's an issue of let's prevent it from happening. The reality, I've always been, having grown up here and lived in a 50-mile radius all my life, I'm still overwhelmed by the fact that our social norms dictate how we relate to addiction. Since I was a little child, I can remember people saying, the poor alcoholic, they have a disease. We've always acknowledged they had a disease. The person who uses tobacco, we call it a bad habit. And the person who unfortunately uses drugs, we call it choice, even though it is not. So we really need to come to the realization that this is a chronic disease. It never is over. They are trying every day to stay clean, to stay sober. And so while we are really in this loop, we're split into 4 groups, but it really is a loop. And so at least for my part, the commitment to recovery, supporting people who have taken the steps to stop, even though they may stumble and fall again, is an incredible part of what we can do as a community to make them understand that we know you have a disease. We're not pointing a finger at you like you're a criminal, which we have done for too many years. And so you could see our recovery buttons, and we're hoping that that some of you will get involved. But as a first step, what we're doing in the recovery meeting is we are trying to bring together people in recovery to talk to us about what barriers do you have? Where do you have to go out of town to have things happen? Do you feel comfortable living in your community? And then the next step is taking what they tell us about what we need to become a recovery-friendly community and hoping to work with all 4 of our towns to make that happen.
Thank you. Thanks. Thank you. Other questions?
So I have a couple questions, if
Yes,
you
ma'am.
will, please. I'll start with the flu program, your influenza program.
Yes,
Do you have an age limit? Do you do first dose for kids? And do you have different types of vaccine that you use?
Generally, we do 4 and above, so age 4 and above. Under 4, pediatricians are the best place to go for the flu shots there. As far as the types of flu shots, we have had the quadrivalent vaccine, so it covers 4 different strains, and that's really been what we've used over the past 2 years.
And it's better than the senior shot.
Yeah.
That's only covers 3.
Yeah, the senior shot, which a lot of people refer to as the high dose shot, that is only a trivalent vaccine. So it covers 3 different virus types.
And nasal's gone.
Yeah, nasal is gone. I was going to address that. Thanks for keeping me honest, Pat. So the nasal spray, the flu mist, here over the past 2 years, they found that it hasn't been effective. So we haven't offered that. So really it's back to the traditional shots. And we see quite a few kids. We'd like to see a lot more because, you know, as many people know, kids are wonderful vectors of disease. What they have, they will share. So the more kids that we can get vaccinated means that there's less sharing of that virus.
So do you ever utilize flu block as well?
Flu block, you're talking about the protein sciences
Yes.
vaccine? No, we haven't as of yet. That doesn't mean that we won't, but we have not as of yet.
Okay. And then my other question is, you said that you had 2,000 people that you vaccinated, knowing that I think you said 98,000. So what is your thought of the rest, I mean, in terms of herd mentality that you would want?
Yeah.
And considering we've had this year it's a poor match, and we've already had 1 death in Connecticut.
Right. The issue that you're talking about is how we know what the rate of vaccination is within our communities. And unfortunately, because with a lot of vaccines, there's required documentation, there's an actual database that shows who got vaccinated. For flu, there's not. So I can tell you how many shots that we've given, but we know that that's much more shots that happen in the community beyond us. So really what we try to do every year is to get the message out there to go get your flu shot regardless of where you're going to get your flu shot. As far as, you know, to try to be able to build up that herd immunity. We have talked to the Connecticut Department of Public Health, and I think that from a policy perspective, they may start to change that reporting requirement for influenza in the future because they recognize that that's something that we really can't tell. And from a public health perspective, it's kind of like flying blind. I'd really like to have that number myself, to be completely honest.
And then my last question, I apologize,
No.
is do you provide the shot to people regardless of their ability to pay, or those without
Absolutely.
insurance?
Absolutely.
Wonderful. Good to hear.
Anybody that walks in for a shot gets a shot.
And that's great. And by the way, I did 47 shots in 20 minutes at one of my clinics.
Awesome. And let me tell you, our nurses, and we really do have some great volunteers. And back when we had H1N1, they were doing hundreds an hour. And it was remarkable for folks to see. And that's the type of test that, you know, we may be involved in if we get into another pandemic. And the vaccine is the best way to be able to protect. So that's really, I think, one of the key factors of why we keep doing those mass vaccination clinics, is to prepare for that big one that's coming.
Yeah. Thank you so much for your answers.
You're very welcome.
I have a question.
Sure.
With respect to the opioid crisis and doing public outreach and the various programs you might offer, what does that entail? I mean, do you go into the schools? I mean, I'd like to actually learn more about it and become involved.
Oh, absolutely. Right now, because we're still kind of in the formative stages, and we have the work groups they're actually working on how do we do that outreach, and we're doing this really with no funding. So really what we're trying to do is work within the communities. And one of the things that we've done is worked with the local prevention councils within each one of the towns to really try to get a standardized approach for how they reach into the schools to be able to do that type of prevention work. So what we've tried to advocate for is athletes really are at a particular risk of opioid because if somebody gets hurt, one of the first things that they do is they actually prescribe painkillers. And Connecticut's addressed that with some legislation limiting the amount of painkillers that they can get from 7. Now, if they're under 18, they can only get 5 days worth of opioids to be able to deal with that. But what we've tried to do is, because each time in the fall and in the spring, the athletic departments have to have sessions with their kids and their parents. So why not include opioids and the risk associated with opioids at that particular time for that audience? So we're actually working with local prevention councils to be able to launch that hopefully in the spring.
And CCAR
Yep.
is very interested, as well as the Department of Mental Health and Addiction Services.
Yeah, you got to get on the mic, Pat.
The Department of, we're very lucky to have a board member from Weathersfield who is just retired from the Department of Corrections and has done this stuff for years, and she's fabulous. She also has great connections to the Department of Mental Health and Addiction Services, working very closely with their, I call it APCD because I get the wrong committee, ACDP committee. I don't remember all the initials, but it's working with substance abuse. They are very interested in what we are doing. They're not giving us money, but we're looking to them for support, and also the Connecticut, what's CCAR stand for?
I knew you were going to ask me that.
Connecticut Recovery Program, right down in Weathersfield. Those of you who live here, they are right here, and they have 3 different offices in the state of Connecticut. They are a resource office. They also are training people to be counselors who the hospitals have now started to hire. So if you show up in certain hospitals, including St. Francis, there is a counselor there who can work with you to get into whatever services you need immediately. So if you're interested, Joanne, I'd love to sit down and chat with you.
Great, that would be wonderful. Thank you.
And I will say, one of the things that we did at the last stakeholder forum that we had was we brought down a gentleman from Massachusetts, and he was really talking about the intersection between behavioral health and issues that they have as far as what they call, and
It was trauma.
yeah, it was trauma related as children. So how we can hook children that have gone through trauma, whether that be domestic violence, things of that nature.
Eventual self-medication.
Exactly,
Right.
to be able to start to address that very early with a connection between the police and the schools, so that they're aware of something that's gone on and can address those things. Berlin's been great because the Berlin Police Department, they've been doing this informally, I think, for some time. And even as part of what we've been doing with the opioids, we brought in Chief Montminy from Manchester, Connecticut. They have a project called Project Hope, where the police department actually is able to do a warm handoff to an emergency room if they feel like a person would be better suited for treatment than incarceration. So they have a relationship with the hospitals to where they drop off, they have a recovery coach, and they're able to walk them into that system much more efficiently. And they've seen a wonderful response, because out of 498 people that have gone through that process around the state to recovery coaches, they had gotten 496 people into treatment. So it's a effective program, and we're looking at how potentially they can expand that. And CCAR is one of the agencies that actually trains those coaches, and we're working with them as well.
Thank you.
Okay. Thank you.
Thank you. Okay. Charles, thank you very much.
Thanks, Mr. Mayor.
You didn't
Thank you.
expect this to last an hour.
No, it's great. No, it's all good stuff. We're glad you're here. We're always glad to see you.
And I swear one day we're going to get the technology stuff figured out in this room.
So the whole
It's all new.
You're doing a lot of other important things,
Thank you.
so we'll let you slide
Thank
on
you.
the technology.
And happy holidays.
Same to
Same to you. Thank you.
Thank you.
Okay. We are, so 1A, right? We're going to just cover,
First, I want to make a motion to add agenda item, I guess, number 8. We'll just put it at the end for the gas contract.
Second.
all's in favor?
Aye.
All right, so moved on that. That's 8. And number 1A, former consent 3. You want to make a motion? We can discuss it?
Well,
Or you want
we
to
already
discuss
did that, so I don't know, is there anybody, yeah. Have any input, Jack?
Yeah, this is it's a standard request for fee waiver to waive the police fees. The Minuteman Wrestling Club runs a tournament, a fundraiser for children from 4 to 14. It's going to be held at the high school. Berlin High School. My understanding is that the Board of Ed, or at least the administration, is in agreement that they are approving that to be held. It raises funds for the program, but also raises funds. They offer a yearly scholarship to one wrestling student from the high school. It says to more than one student at the high school. And so it's just, it meets the requirements, so we recommend, or we approve or recommended the waiving of the fees. And I did talk to the police chief. We talked about it today. They have to provide the staffing there. It's a school function, and they're required to. So.
I was talking to the mayor earlier, and I had a couple questions about this. Number one, I had asked for a list of all the waivers that was approved by the council, and I got the ones from fiscal year 16, 17, but it seems like only a partial list. So do you have a listing of things that we've waived for the whole entire?
I can get it for you for any fiscal year you want.
Okay.
We do do it by fiscal year.
Okay, because yeah, this one's only partial because it was in the manager's report. So I'd like to see what we did in the entirety for all organizations last year.
I can get that for you.
Okay, thank you.
Okay. Just a question too. Do they? So the high school, is there a fee to them to use the high school or no? Do we know that? Just out of curiosity. No. Just curious.
There's usually a fee for the
custodial staff.
Custodial staff. But that would be administered through the Board of Ed.
Board of Ed, yeah. Just curious. Okay. All right. So if moving forward, we want to make a motion on this.
Sure. Move to approve the request of the Minutemen Wrestling Club to waive all fees associated with having 2 Berlin police officers at Berlin High School for 8 hours, 9 a.m. to 5 p.m. on Sunday, January 14th, 2018, during their annual Minutemen Royal Rumble Wrestling Tournament. The total amount of the fee to be waived is approximately $1,072.
Second on that?
Second.
Thank you. Any further discussion?
Yeah.
Yes.
Just to say that this is a local organization. This is the feeder system for the wrestling, as a little league would be for baseball. So it's not unusual that we grant these.
Another question. Do we have a fund for these? Like when we do waive things that actually have a dollar amount on them? Because a lot of the things that we've waived are like we've waived rounds of golf at Timberland, which really doesn't cost the town anything, kind of. We've waived field rental fees and room rental fees, which really doesn't cost, the town anything. Do we have an account that we have a certain dollar amount of money that we can waive, or do we just waive whenever we want to waive?
Well, to my knowledge, there's no fund for that. It just decreases the revenue that we would collect for those operations.
I believe that for this year, the budget committee decided that something like the Berlin Fair, they put that in the budget, acknowledging that was going to be waived.
Right, that one was
Wasn't
significant.
Yeah, and there's a couple, I don't know about the other ones, but I can definitely find out for you, but especially because the fairgrounds is such a big one at the 27,000.
Right.
That, and I think that's only the traffic, right? And so what the police that are on the grounds, they pay for those. It's only the traffic that is waived. And that was accounted for in this year's budget.
Okay.
That was being started.
Yeah, I thought we did that.
Right?
Just looking down the road to the cuts that we're looking at, I'm
But I
curious.
can find out more for you because that was new this year, I believe. Yeah.
Previously, my discussion with Kevin was that many of these, when we do a fee waiver, it's a reduction in revenue that we would anticipate. So, there are cases like the Berlin Fair, which are large enough, but there are a lot of these that we don't anticipate. There's smaller ones that they come up with.
Right. I mean, a reduction in revenue on room rentals and things like that, but when you're waiving like a police fee, there's actually a cost to every dollar. So the town is actually incurring costs by waiving this. Yeah, just want to make that clear.
There's a precedent that we have waived fees in the past for charitable meetings, etc., so that last year this was waived.
I can't tell you if the, and Jack, excuse me, only because I think she's looking at me because I've been sitting here for a long time.
Oh, sorry.
Is that, but we can do is I can get you the past couple of years. They have tried to rein in the number of waivers that are done. So every year I think they are being looked at more and more closely. You're totally correct. So I can maybe get you the past 5 years. And you can see, everybody can see where we've been doing and where it's been and how it's going forward, especially as you will be looking at the budget also.
Okay.
So I can get that for you.
Thank you.
The finance department does that every year.
Thank you.
Okay.
Yeah, maybe we could get all that information to all of us and, just look at it for the next meeting and just discuss it,
Of course.
see what we think. Okay. Motion, do we make?
We did.
We made a motion, it's on the floor, we had discussion, all right. So hearing no further discussion, all those in favor?
Aye.
Aye.
Any opposed? So moved, thank you. Number 2.
Agenda item number 2 is approval of the drainage easement that you had the hearing for tonight. The easement will permit the drainage from Fuller Way into a pond that's on town-owned property. And this, as they said, has been in place for many, many years. Chris
Okay.
Edge is here if there's any questions.
Okay. We'll make a motion.
Move to authorize the acting town manager to execute a drainage easement with the Big A LLC related to its property at 76 Fuller Way, subject to the review and approval of Corporation Council.
Second.
Second, thank you. Any discussion?
Good.
Hearing none. All those in favor?
Aye.
Opposed? So moved. Thank you. Number 3.
Agenda item number 3 is we are a member of the Capital Region Council of Governments, and they act as our grant allocation administrator. We are entering into a Homeland Security Memorandum of Agreement and require the town council approval to enter into that agreement. Matt Odisha was here to discuss it.
Okay. Great.
Matt's coming up.
Good evening.
Hey Matt, how are you?
Good, how about you?
Good.
Basically, this has been going on since September of 2010. And in a nutshell, when we were part of CREPSI, this is how this all started. Instead of giving money that came in from the federal government to each town, the state agreed to take all the monies into one sum and use it throughout the 41 towns of our region. And basically what this is now is they have a budget that's set up, and there's certain parts of this funding. The funding is actually, it's dwindled down to just under $350,000 a year now. When this thing started, it was in the millions. So there was a little bit more of a priority back then. But certain monies are allotted. There's money allotted for the bomb squad of Hartford, which is $55,000 of that money. But basically, it's for support of the region for emergency services, hazardous materials incidents. There's also some things actually where they'll actually pick up overtime charges if we send somebody to training, especially the police department. You can actually ask for reimbursement of the overtime to fill its slot if that officer had to go. So it's just basically an annual MOU and resolution to let them manage our monies, basically. That's all it is.
So the total for the region is 350,000?
Yeah, the total.
That's all it is now, huh?
Yeah, for 41 towns is $348,000.
That's kind of grim. That's
Yeah,
not a
it
lot of
is.
money. Yeah.
Considering, like I said, it was in the millions, I think, in 2010, so it's...
Yeah.
And again, a big portion of that is, about 100,000 is actually tied up in certain specific items, so,
okay.
It's down to about $250,000 for the 41 towns.
Okay. Have we gotten anything out of it lately, or no? out of curiosity?
I think what we got a couple of years ago, we picked up about 72 or 80 cots that we agreed to watch for them, that basically if they wanted to take them, and they probably forgot we have them. And I'm not about to remind them.
There you go.
We have picked up a few things. The majority, to be honest with you, the majority of this money goes to towns that are agree to hold the region hazardous materials trailers,
Oh,
the
okay.
SWAT
Okay.
teams,
Yeah, okay.
which we don't, you know, if we use them, like the incident at the Best West, or at the Days Inn, if we use a SWAT team, then basically, you know, that's helping defray some of those costs. So it's more of an indirect use we get out of it.
Gotcha. Okay. Thanks, Matt. You have a motion on this?
Okay, I'll make a motion to authorize a resolution that the Berlin Town Council may enter into with and deliver to the State of Connecticut Department of Emergency Services and Public Protection any and all documents which deems it to be necessary or appropriate, and further resolve that Jack Healy, acting town manager of the town of Berlin, is authorized and directed to execute and deliver any and all documents on behalf of the Berlin Town Council, and to do and perform all acts and things she deems to be necessary or appropriate to carry out the terms of such documents, including, but not limited to, executing and delivering all agreements and documents contemplated by such documents.
Okay, thank you. Second on that?
Water.
Second.
Thank you. Any further discussion? Hearing none, all those in favor?
Aye.
Aye.
Good.
Opposed? So moved.
Thank you.
Thanks, Matt.
Agenda item number 4 is permission for consumption of alcoholic beverages at Timberland Park for Eric Newman wedding to be held in August of 2018. As you recall, last year we started going through this process. We reviewed the form that normally is approved by Park and Rec, and we determined that per the charter, the town council is supposed to approve this prior to it going to the police chief and to the town manager. So we're bringing it before you for approval for the consumption of alcohol. They will have to provide the standard insurance and other documentation upon approval.
Okay, great. Motion on this?
Okay, move to approve permission for consumption of alcoholic beverages, an open bar with bartender serving beer and wine at Timberland Park Pavilion for the Eric Newman wedding on Saturday, August 18th, 2018. Tulip insurance will be obtained if alcohol permit is granted.
Second on that?
Second.
Thank you. Any discussion? Hearing none, all those in favor?
Aye.
Any opposed? So moved. Thank you.
Okay, agenda item number 5 has been withdrawn, so we're on to agenda item number 6, which is the increase in contract for the J.A. Rosa Company for the work related to the Peck Memorial Library. The project has hit a couple of needs a couple change orders. Doug Solik is here to discuss it.
Okay.
Good evening, everyone. Welcome to the new
Hey, Doug.
members.
How are you?
Welcome back. We had a couple surprises happen with the elevator, to say the least. We found some rock that dates back to before the dinosaurs that we had to excavate, so we incurred some extra cost on that, and then there was some electrical change orders that had to happen, so the project's a little bit over what we initially had for contingency when we started.
Okay.
All right, and so what are you asking for an additional, what, 40,000?
Yeah, currently we need about 17,000 to cover, but we have one more change order coming back for the final round of excavation, so. We're hoping not to come back to you for any more, so we just wanted to bring enough to cover what we may need. Hopefully we don't need it, but it's there if we do.
You can't find any dinosaur fossils in that
No
rock?
diamonds, no gold.
Nothing.
No oil wells, nothing. Sorry.
Well, you tried, right?
No bitcoins?
Yeah, right.
Bitcoin.
Right, yeah. Okay, all right.
Okay.
Let's take a motion on this.
Sure. Move to authorize the acting town manager to increase the contract with J.A. Rosa Construction of Wolcott, Connecticut from $304,280 up to $344,280 if needed.
Okay, second on this.
Second.
Any further discussion? Hearing none, all those in favor?
Aye.
Opposed? So moved. Thank you. Thank you, Doug. Good luck. Hopefully no more problems, right?
We're on to agenda item number 7. This is the town council calendar. On an annual basis, you have to adopt a calendar, and I believe you reviewed this before, so that you should have a good idea when you're going to meet.
Yeah, so, yeah, this is the, we changed dates? We
No,
did
the
last time, right?
annual budget hearing was pushed into March by
Oh, yeah,
the
right.
Finance Board. So I didn't cancel the April meeting. That was really about it, I think.
Okay, you guys all looked at this?
Yeah, just a question.
Yeah.
Yep.
I guess a procedural one. Are we still going to have budget hearings?
Which one? So, I think the goal would be to, let's see, what are we saying here?
If you look at March, it shows our normal
You're
budget
looking on there, right? Let's see.
meeting.
Right there, okay.
But I mean, if the Board of Finance is going to have,
Well, I think the thing that we probably need to do is, and we'll work it out with the Board of Finance, but, you know, I guess my big question with this whole process, those of us that have been through, having been through the old process, is the budget ultimately comes to us, right? So somewhere we need to be educated as well, as much as the Board of Finance is, right? Because we certainly have, you know, within our purview to, you know, not accept the budget, accept it, and or lower it. So, you know, whether we do it, you know, I mean, I think it's worthwhile to have certainly a joint meeting somewhere along the way with the Board of Finance, I guess, before maybe they finalize. I don't know, we can talk about it as we go forward, Sam, since you're here. And then, you know, we have to figure out a way, I guess, throughout the budget process where the Board of Finance is having the meetings that we used to have, but we certainly have to be kept up to date as well, because obviously it's going to come to us, and I think we have about like a 5-day turnaround to make a decision on, you know, whether we, you know, whatever we agree with their budget or not before it goes to referendum. So, you know, I think we got to figure out what's, you know, corporation, you've dealt
Well,
with,
yeah,
but
you
I just want to make sure we're,
Well, there's,
you know,
obviously-
we can't learn everything in 5 days, you know, in a couple days, so how do we,
Yeah, I mean, if you want to have a joint meeting with the Board of Finance, obviously that's not the annual budget
Right.
hearing.
No, that's just
The
a joint
annual
meeting.
budget hearing is
Is-
going to be, as we talked about last week, is going
Yeah.
to be conducted by the
Yes.
Board of Finance.
Right, they take that over from us, yeah.
And certainly
Yeah.
if members of the town council want to attend the annual budget hearing.
Yeah, of
and
course.
Listen to what residents have to say.
Yeah.
That's, you know,
Hmm?
certainly within your purview.
So is that what
If you want to
you're-
have a joint
Well-
meeting with the Board of Finance and.
my concern is we're going to have budget hearings, and I assume they are too. So is,
We're not having budget
We're not
hearings.
having budget
We're not
hearings
having budget
anymore.
I'm sorry, I mean
Yeah,
budget
uh,
meetings, as we did in the past. So I assume the Board of Finance will
Well,
also.
you're not having
Not the way
departments
we used
come
to.
before you.
Nope.
That's the
not
Board of
doing that.
Finance.
Okay, that's my
Yeah,
question.
yeah, we don't have that anymore.
So
No.
But what are we going to have at our budget meetings then?
You're gonna have the end product.
Yeah, I mean, that last meeting would be with if we have a meeting before, let's say, the Board of Finance sends the end product to us, just to discuss it with them, right?
If you want to have a meeting, that's fine.
Yeah, but I mean, so the way it has been, Pete,
So
you
that
know.
isn't us?
Let's see.
He's looking at the calendar.
So you're looking at the calendar,
Which I
so
can do.
the
You're talking about the end?
the 5th, the
last
5th
page?
through the 7th of March. Yeah,
What I did was
what do
I
you call-
gave
You
you,
combined them all, is what you did, right?
at the very end,
Yeah.
or not the very end, well, yeah, there is, there's really 2 sheets, same thing. It is a budget calendar for the Board of Finance.
Okay.
So that's the 5th through the 7th is their calendar, is that what it is?
It is gonna start on the 5th, 6th,
Yeah.
7th, the 12th,
Yeah.
the 14th. There's all those meetings, but it's, the Board of Finance will be having those budget meetings.
Not us.
Right. So they will meet with the different departments.
Okay.
Right. Yeah, okay. And then somewhere maybe after that, we could talk to them?
Yeah, I mean, if you have questions, if you
Mhm.
have questions about what you expect to receive from the Board of Finance based on your perception of what's talked about at their meetings, or after you receive it, you certainly can schedule a joint meeting. It's not a budget hearing.
Right.
But if you have questions about line items or anything else with regard to the proposed budget, you certainly can schedule a meeting and have a discussion with that board.
So without attending all those meetings, which I don't mind that we don't have to go to all those at this point, but what do other, just out of curiosity, because again, we're all still learning here, and I know you've handled some towns that have the Board of Finance, and I know,
All of
Jack,
them,
you've been
yeah.
on them. So all of them, okay,
Yeah, they
so
all have Board of Finance.
they all have Board, so I just like curious, so let's say we do nothing, Board of Finance handles it all. So now it's sent to us. So we have a 5-day turnaround time. So in 5 days, knowing our budget as I do for the last 2 years, you know, it's difficult. We can't go through that whole budget in a day and figure out what we like or don't like or what we think is right or wrong. I mean, obviously, would be the meeting would be perhaps a meeting with the Board of Finance before it comes to us. Would make some sense to me if the chair agrees with the Board of Finance. We just have a meeting to discuss once they get down to the bottom line, but maybe before it comes to us officially.
Well, you're going to have,
How do we-
there's going to be areas of the budget that each of you, when you review it
Right.
individually, has questions about.
Right, of course.
And, you know, whether or not you have a council meeting to, you know, go council member by council member and figure out what the questions are and then present them to the Board of Finance.
Oh, okay, yeah.
In some, you know, concise
Yeah.
manner because of the time limitations and
Right.
because of your desire not to duplicate efforts.
Right.
That would be the approach that would make the most sense.
That's
you know?
before it comes to us officially, is what you're saying.
Yeah, I mean, you're gonna have an idea,
Right, of course. We'll
based
try-
on what the town manager sends the Board of Finance.
Right.
What that looks like, what the
Right.
budget looks like.
Right.
You're not gonna know what the Board of Finance does with it
Right.
until the Board of Finance votes on it and sends a work product to you. But
Right.
if you have questions based on what the town manager provides to the Board of Finance, then you can begin that dialogue earlier.
Okay,
There's enough time in there.
okay. Yeah, we'll figure it out. I
Yeah,
mean,
because it's not, a lot of the items you're gonna, you know, they're not gonna be surprises to you when they come from the Board of Finance because they're gonna be
in the town manager's budget.
fairly consistent, I would
Yeah.
assume, with the town manager's proposed budget, so.
Right, other than perhaps.
But I'm thinking in the past, where, for example, the Veterans Advisory would call us and say, hey, we need 5,000 for flowers or flags or something.
That's what they need to do with the Board of Finance.
Okay.
Yeah.
Now, certainly, when it comes forward, we don't agree with what they have done.
Right. We can add it or
We'll
whatever.
add it or subtract it or send it back or whatever is provided for in the charter.
Approve with reductions, or reject.
Okay.
Those are the three options.
And the approve obviously goes forward to the referendum.
Yep.
Automatically.
Yep.
The approve with reductions goes forward
Goes to
automatically.
referendum. Yep.
To referendum. And the disapproval
Goes to your,
Rejection
back to
goes
our,
back.
goes to your,
to our super,
your big board.
our super majority 9-member
Right,
board
9
if it's
members must approve it.
if it's a rejection.
Yep.
We gotta wear capes.
Yeah, okay. I mean, I guess I guess we'll get through this.
Yeah, I
All of
guess-
us have
I
to get
guess.
through it,
Take it one step at a time.
and we will. Yeah, and it's new to all of us, so you know we'll work it out. I just the only concern I have is knowing the amount of information we got in those budget hearings. You know, the budget, the final product comes to us from the Board of Finance, so I think it will, you know,
They'll do a good
fall
job.
to all of us to, you know, kind of keep track of it as it goes through the Board of Finance. And they are a fellow board. I'm sure we can call them and ask them questions too, unofficially, and talk to Mr. Healy and Mr. Delaney, you know, just so we're all up to date. So at least when it does come to us, we at least have a good working knowledge, you know, because we're not going to have a lot of time to deal with it.
Nothing precludes us from going.
No, we could go sit in at the meetings or public hearings. Yeah, absolutely. So we can sit in
Or
on
watch
them.
them, I'm sure they're gonna be
Yeah,
filmed, right?
yeah.
Yeah.
Go to them as, you know,
No,
we were in them before.
Oh, they're not.
No, they weren't. No, they're not. Those budget hearings were not on tape. Right. So we'd have to go and sit there. But, you know, we'll have a schedule much like we had before, right, Peter? You know, we know what departments where, and if we're interested in that particular issue of the budget, we can go.
Do you take minutes in there?
Yes, I won't be the secretary there, but they do have she's very good. Dana's excellent, and I'm sure that she will.
So we'll have access to the minutes, correct?
Yes.
Okay.
The problem is, I'm going to tell you, it's very hard. I'm sure she'll do it, but there's a 7-day deadline on when you're supposed to have the minutes done. And these meetings you have
they're back to back.
meetings very quickly.
Okay.
With a lot of things happening. All right, so it's kind of hard to get everything to you.
Okay.
But I'm sure, knowing Jack and everything, he'll make sure that you guys are comfortable and that you can get what you need.
Okay.
And of course, there's nothing that precludes you from, to the extent that you have questions, like I said, once the town manager sends the proposed budget to the Board of Finance, you'll be privy to that. There's nothing that precludes you from contacting the town manager and asking him whatever questions you have. I mean, I would funnel all the questions, obviously, to the town manager, not to the individual department heads.
Yep.
Right, yeah, sure.
And of course, the Board of Ed budget, you're not going to, it's no different. When I was on the town council in Trumbull, before I went on the Board of Ed, the Board of Ed, we have 3 meetings. We spend about a dozen hours. Our budget this year is $105 million. Nobody from the town council is at those meetings, but they do have the benefit of the superintendent's presentation to the Board of Finance.
Oh, yeah, okay.
Which is very, in 30 minutes, he condenses a dozen hours worth of discussion. So you're going to be in that situation where you're really getting the Reader's Digest version. But again, when you look at the budget, there'll be specific proposed increases or proposed reductions in that budget that you'll flag because they're of interest to you individually based on whatever your specific concerns are about the town government side of things. Right. And there's certainly nothing to preclude you from, funneling those questions to the town manager prior to receiving a proposed budget of the Board of Finance. The only thing that happens from that process is you kind of, try to not to bombard the town manager with questions, because it may well be that some of the things you're asking questions about don't end up in the budget that you get from the Board of Finance. They may get vetted and modified through the Board of Finance, and you just don't know that. It's not a perfect process because
We don't know till the end.
but that's the way it's supposed to be.
Yeah, right.
You're supposed to give, each of you has your opportunity to put your stamp on the budget, your mark on the budget. So just as the Board of Finance presumably isn't going to know what you're going to do with the work product they send you, you're not going to know what they're going to do with the work product that Jack sends them. Unless you get it, unless from their meetings when you attend, you hear a majority of the board, make comments about, well, I don't think this is a good year for us to add a person in public works, or, whatever the particular concern. It's not a good year to add 5 police officers, whatever. There'll be individual things in the budget that, from a, communication perspective, you'll have time to find out. At least, and if it's not in the Board of Finance budget, it's one less issue that you have to talk about when it's your turn to approve or reject the budget.
Right.
So if you funnel the question through Jack, you get the answer, you understand why it's in the budget. If it turns out that it remains in the budget when it comes to you from the Board of Finance, you'll be informed and you'll be able to vote from an educated perspective. If it's not, then it's just one less issue to worry about.
It's not there, right.
Right. So that's what I would do is, funnel questions through Jack, because it's going to be all the department heads have to submit their request to Jack, and Jack is responsible for sending the initial go of a budget to the Board of Finance.
Right. Okay. Yeah, no, we'll, hey, we're all got to get through it. We will. New process. We'll figure it out as we go. I'm sure it will all work out fine in the end. Everything always in the best interest of the town. I'm sure we'll get it done.
Well, what ends up happening is you have much more discussion because of the addition of the Board of Finance. You'll still, because of your being conscientious and because of your background, past history as the fiscal authority for the town, you'll still have a high level of scrutiny and interest in the budget, but it will have already been, vetted and discussed ad nauseum by the Board of Finance before it gets to you, so really it's,
So
it should be a very well vetted budget.
So so the benefit is that the poor town managers will get worked over by the Board of Finance, before it gets to us, so we don't have to work them over like we used to have to. The Board of Finance could do that now,
It's true, in towns like this where there's a council manager, form of government, it's the manager. In towns where it's a, Board of Selectmen with a town meeting, or a first selectman with a council, it's the first selectman. So there's always got to be somebody.
Sure.
Because under every chartered town in Connecticut, the budget originates somewhere.
Right.
There's no form of government in Connecticut where the budget originates with the department heads.
Right.
Okay.
They wish it was that way, I'm sure, but.
Well, if that was the process,
Yeah.
then you would have to start around September.
Right.
To meet the statutory deadline of May.
Yeah.
So.
But we
No
cannot.
offense to the department heads.
No.
Jeff, we cannot add anything back into that budget.
Yep. Right, so what happens is if you feel that, gee, you know what, there's things that should be in here that aren't in here, then you vote to reject the budget.
Yeah, that's what we got.
Yeah. Nice.
Okay.
Okay,
So, calendar, we good with the calendar?
so far.
Pretty happy with it? So we'll just take a motion on that?
I will move to adopt the town council meeting calendar for 2018 and January of 2019.
Second on that?
Second.
All those in favor?
Aye.
Opposed? So moved. Thank you. So, number 8.
Number 8 is locking in the gasoline contract for the calendar year 2018. Jim Simons is here to discuss it. What we're looking at is a one-year contract with a consortium bid from CROG through the low bidder of East River Energy, which is one that's very commonly used. They're typically the low bid for municipal contracts. Jim and I discussed it. We can either lock in or we can go with market price. We talked back and forth. To be honest, I push to go with the contract. I'm a conservative by nature, and I don't want to take the chance that if we go out and the price goes up, we're left hanging with a budget issue. So I recommend that we go with the contract.
Okay. Anything to add, Mr. Simons? No? Oh, well, no. I knew you'd come up here. Come on.
They always tell me not to talk.
That's okay.
So the contract's for 74,000 gallons. It's for 1 year. There's a 14-cent increase over what we currently are buying fuels for from last year. Much like you're paying at the gas pumps, probably about 14 cents more. We will be purchasing that 74,000 gallons at $1.89 a gallon.
Okay.
Wish I could buy it at that price.
No.
Haven't seen gas go down lately.
No, it's not gonna. Okay. Any other questions for Mr. Simons? No. Make a motion?
Okay, move to award the contract for the purchase of 74,000 gallons of gasoline for the calendar year 2018 to the lowest bidder, utilizing the CROG Purchasing Consortium.
Second on that?
Second.
Any further discussion? Hearing none, all those in favor?
Aye.
Opposed? So moved. Thank you, Jim. Thank you, Jack. Okay, that ends that, so we're going to go to our appointments now. We have some applications for constables. So we'll just take them, we can just take them.
Do them one by one?
One by one
all
here, go
together?
through as they're in our packet here.
Okay.
So we'll just take
Do you want me to just make sure everybody knows what I...
No, I think we can, yeah, we're good. So, take the first nomination would be John.
I don't know what you have here, it doesn't matter. I'll
Beccaro.
nominate
I'll give you a hint.
John Beccaro.
Yes. Any other nomination for that position? Hearing none, close those nominations and vote on Mr. Beccaro. All those in favor?
Aye.
Opposed? So moved. Okay. Second one, I have.
Okay, I will nominate Anthony DeFranco.
Okay. Any further nominations in that position? Hearing none, close the nominations, and all those in favor, Mr. DeFranco?
Aye.
Opposed? So moved.
Yep. I will nominate Paul Eshu.
Okay, thank you for the nomination. Any further nominations? Hearing none. Nominations are closed. All those in favor of Paul Eshu?
Aye.
Aye. Opposed? So moved. Lindgren?
Yep. Okay, I will nominate Mr. Ronald Lindgren. I had the wrong one.
Thank you for that. Hearing no further nominations for that position, all those in favor of Mr. Lindgren? Aye.
Aye.
Opposed? So moved. We have Mr. Mata, so he does not want to serve another term. We will, I possibly have another applicant for that. I don't have his paperwork, so we can push that on to, since it's an opening, we'll push it on to our next meeting as soon as we get the application in. Next one.
Okay, next one is Mr. John O'Brien. I will nominate Mr. John O'Brien.
Okay. Any further nominations for that position? Hearing none. Close the nominations. All those in favor?
Aye.
Aye. Opposed? All right, so moved. And one more.
I will nominate Mr. Robert Zipadelli.
All right. Any further nominations? Hearing none. Close the nominations on that. All those in favor?
Aye.
Opposed? So moved. All right. Thank you very much, everyone. Move on to our town manager report.
Okay. First thing I'd like to do is have a couple pieces of correspondence. The first one, John Zook is here, so I'd like to read this one. Dear Mr. Healy, it is again a pleasure to report on the Bluebird program at Timberland Golf Club, our 18th season. We produced 61 fledgling bluebirds, one of our best years ever. The new houses erected last August by Eagle Scout Scott, Alex, and I'm going to mess this up, Gazakis, played a role in our success. Jonathan Zook, Mark Byram, and the entire Timberland staff continue to be extremely helpful all season long. Sincerely, Vincent Ringros, Junior, MD. So I just want to thank John and the staff at Timberland for cooperating and helping with the Bluebird project. So thank you, John.
Thanks, John.
Thank you. I enjoy those bluebirds all the time. I live right on the golf course.
The second piece of correspondence is from the Berlin Police Department, Sergeant Todd Lentina. It's about the Wounded Veteran Parking Program. The Berlin Police Officer, Thomas Bobick, has brought this recommendation forward. As the supervisor and with the blessing of Chief Klett, I am forwarding you this request, which has the full support of the entire police department, which many of which are currently serving or have served our country. As of today, there are approximately 1.8 million Purple Heart recipients. The Wounded Warriors Program, family support in an organization that helps the recognition of these veterans. Our campaign that they run is Reserve Parking Campaign, and they would put up the sign at Town Hall. The only cost to the town would be the painting of the parking spot, which is pictured in 3 different formats, and I have the formats here. A recommendation would be to a few strategically placed parking spaces at Town Hall Complex and Veterans Park. These reserved spots are offered as a courtesy and are in no way enforceable if someone were to park there in disregard of the sign. This is a simple way to show that our town Berlin honors the service and sacrifices made by the veterans in Berlin and any others that may be visiting from the outside of the town. And my intent was to approve this and to install one at the town and one down at Veterans Park. So I wanted to make you aware of that. I think it's a good program.
Sounds great to me. Thank you.
Thank you.
Would a Purple Heart plate show compliance? I mean, they are out there.
Again, it's not enforceable. Yeah, it would show compliance. I think the idea is that we're showing support for our veterans, and I think in this day and age, it's very important that we do that.
Yeah,
absolutely. Great.
The only other 2 things I have, other than wishing you a Merry Christmas, is that the VNA has been going through. I thank you for approving the 2 people that we hired. They both accepted and are getting ready to start. So both of them will be in place by January 8th, and we are getting overlap and help. So thank you very much for that approval. The VNA has approved a recommended replacement for Linda. We're going through negotiation with her, and we'll report to the town council once that person is approved and hired by the VNA. That's working out very well. We are going to be able to get an overlap with the current our end, so that we're going to have the be able to train her in place for a short time. The last thing I think is a follow-up to the last meeting is about the noise situation over Commerce Street. We've met with the company, and we are working with them to come up with a plan to address that, including putting some enforceable signs for no idling. They're going to look at putting some more additional signage there on their property. They're looking at relaying out their property and addressing that. So we're working with them. We will be meeting again in January.
Great, thanks. I'm glad you're making some progress there, because I know those residents have been putting up with that for a long time, and they shouldn't have to. So appreciate you moving forward on that.
Did you want to mention
Oh yeah, no, but yeah, I was going to ask you. I was going to ask you about that. No, what happened with that?
Sorry, thank you. Yeah, there is the one other thing. The reason that, I mean, the item number 5, which was withdrawn, is they took that to the Golf Commission, and it was turned down by the Golf Commission. I just want to make you aware of it, that one of the things, John has been contacted by NBC Channel 30 about this, and we've asked them to hold until that we as a town, made a decision on whether or not to refund the funds. John did go to the Golf Commission, and they did reject it tonight. So that's why we withdrew it from your agenda.
Okay.
All right. Well, that's their recommendation. Or how are we handling with the Golf Commission?
So it won't come to us.
It won't come to us now?
Yeah, because Park and Rec had rejected originally, and now that we have the Golf Commission in place, I asked John to take it to the Golf Commission, and they rejected it. So at that point, I felt that we should withdraw it from the town council.
Okay. All right. I mean, I thought, yeah, all right. I mean, we had some discussion on that before about, and I think the reason why we were willing to do that was there was some possible wording, if you recall our discussion.
Yeah, I do. And the Golf Commission was aware of that. They went back, looked at that, and they looked at the number of rounds played and felt that giving the refund was against the policies of the town.
Okay.
Park and Rec had already rejected this, and they felt it was to be consistent. They didn't feel the wording was significant enough that they should give a refund.
Okay. All right. Okay. And my favorite topic, or least favorite topic, the blighted property.
That I have the wording for that, and I'm working with Jennifer, so that should go. She sent me the wording on it.
What's the next step?
We have to send them a violation, which she sent me the standard wording on, so I'm working on that, and we'll be sending that back to her before Christmas.
And then once they get that violation,
then
is there a timeline?
There's a timeline on that, and then if they don't, excuse me?
If they don't appeal.
Yeah, if they don't appeal
the violation.
Yeah. Then we have to take further enforcement action.
Was it a health code violation?
It's a property that's been in violation for several years.
I know which one it is.
Yeah.
But, the violation was a health code violation?
No, this is a planning and zoning violation.
Oh, okay.
So, but we have gone out. The town went out and discussed with the neighbors. We did mow, and we have mowed the side of the road. Opened up the trench, the side of the road in the drainage ditch. We also, at the request of the neighbors, we had a light installed out there, a street light, so that would lit up the property, lit up the area.
Good.
Is there a just, these people have waited a very long time, and it's really, I would not want to be living next door to that property. Like the time frame now, I know we're finally moving the process forward after many years, but what do we have some type of ballpark time frame? I know they can appeal, and I'm sure that can take a while, but what do you say?
Have they been issued a notice?
No.
Oh.
No.
No, the notice hasn't gone out yet, right?
Okay.
We sent them that first notification.
Initially, they were notified, yeah.
Okay.
Yeah. We kind of revamped, we started at the beginning of the process. I know you're coming in late, but so
Right.
we started at
That's
the beginning
what
of the
I'm curious
process.
about.
Yeah, because
So we haven't-
it was never completed by the town, shame on the town, quite frankly. And we moved forward, we changed a few things, and we've moved forward now.
When you say changed a few
Yeah.
thing, the wording in the blight
Yes.
ordinance?
So, I don't think the blight ordinance, I think in the notice,
Oh,
right? The notice
okay.
letters, I think we changed some of that, is
Okay.
what we did on Corporation Council's advice.
Right.
But so,
I mean, the whole idea, obviously, is to obtain compliance.
Yeah, of course.
Issuing a notice of violation, and if there's no appeal and no compliance, filing a lawsuit against a resident is really not a very favorable option. The town's not in the business of suing its residents. But if they don't comply and they don't appeal, then there has to be an enforcement action brought. And then if they still don't comply, we get a judgment, we record a lien against the property, and if they still don't comply, you can foreclose that lien like you would a tax lien. So, you know, really, it's the process doesn't do anything other than hopefully stimulate compliance. And if you don't get compliance voluntarily, so the answer to your question, unfortunately, in terms of how much time it takes, it really depends upon the property owner and whether the property owner voluntarily complies. The town doesn't have the right to go on private property and just do the work and then send them a bill.
Right.
The process is we have to get a judgment from Superior Court and then record a lien on the property. And again, it's the last resort, only if there's not voluntary compliance and the resident leaves the town no choice but to enforce.
So would that be like, that would be in the form of a temporary injunction and then
Well,
fines issued on a daily basis, or?
Yeah, what you do is you bring, I mean, again, the injunction procedurally is the right thing to do, but it doesn't get you compliance. Because telling, you know, saying, it's no different than when you issue a cease and desist order on a zoning regulation violation. They either comply or they don't. If they don't, then you proceed with the underlying lawsuit, you get a judgment, you record a lien on property for the civil fine that you're entitled to under the statute. So again, the goal is compliance. It's up to the property owner to comply. The process is the notice of violation, then the appeal period expires, then they get sued in Superior Court, and then you get a judgment. How long does it take from when the notice of violation is issued to when you get a judgment? If there's no appeal and there's no defense in the lawsuit, it shouldn't take more than 3 or 4 months from start to finish.
We haven't heard from this owner, have we? Nothing?
No, we've had no response, no.
After the service?
No.
Okay. Thank you. I just, you know, trying to help out our residents there with an unmanageable situation they find themselves in. So appreciate you guys working hard on it. Okay. Anything else for town manager's report?
No, Merry Christmas.
Good. Merry Christmas. That's a good one. Same to you. Very
Thanks,
good.
Jeff.
Special committee reports. I don't think we have any. All right. Councilor Communications.
I do have something.
Sure. Absolutely.
Some of the citizens in the Fairview Drive area have voiced their concerns about the paving project that had taken place and the fact that the curbs are not, they feel the curbs have not been adequately replaced. That there's been problems with like where the sidewalks are and it hasn't been done right. I know that the asphalt plants are closed, but I think that it's more that they have not felt heard. And I do believe that they need to be heard, and that reaching out to them to say, we'll come out at whatever time to reevaluate and see if it hasn't been done right, or explain why you feel it has done right. I think we owe it to our citizens to do that, to be heard.
Have you heard from them?
Yeah, we did the project in the fall, and I did talk to Brian Griswold after the project. He paid. Typically, what they do is we go out and we grind the road and we do the catch basins and everything, and he replaces the curbing where the curbing was before. And typically, we don't get very many calls afterwards. We have gotten some calls after the project on Fairview Drive. We asked Brian to go out, and he explained that he had gone out and that the curbing was put back, he felt, where it was previously. It's also a very flat area, so there's concern that if you put curbing back, the geometry of the road won't allow for proper drainage. Now, the asphalt plants are closed now, but beyond that, because we have gotten some calls, I talked to Brian, I said, in the spring, we're gonna have to go out, evaluate it, and we'll talk about the drainage and see whether or not the road will properly drain. As far as the curbing goes, at this point, even in the late fall, I probably wouldn't have put it back as they plow, but we typically go out and we do talk to residents after we get calls. On Fairview, I've talked to a couple people, but in general, Brian has gone out and looked at it, and we will look at it again this spring and talk with the residents.
And what is it, there's no curbing? You didn't get a chance to put the curbing back because of the weather? Or?
Well, no, Brian said that he put the curbing back where it was, but there may have been not curbing there before. But the standard letter that we send out to people does indicate that we will grind the road, pave it, replace catch basins, and curbing. So they may be, if they didn't have curbing, they may want curbing, and so we'll take a look at it in the spring.
Okay. What did they say? They're not happy with the curbing? Or?
They're not happy with the curbing. They don't feel it was properly done, or that there's curbing missing.
Oh, okay.
But I think the bigger issue too is they don't feel like people have responded to them. So I don't know, when Brian went out, did he speak with them? Were calls returned to them?
How many people are there? Do we have their names and numbers?
I don't have a telephone number, but I do have 2 names, and that I can get that to you.
That'd be great. Yeah, so we can respond to them directly, and
okay.
Yeah, that'd be great. And then we could
Thank
fix it.
you. I appreciate that.
Fix it in the spring. Okay. Any other councilor communication?
I have one quick one. Last Friday night, I had my first encounter with a black bear at my father's house in South Kensington.
Oh, wow.
Oh, man. So I emailed Chief Klett, and he said, "Well, if it comes back, call." He didn't tell me who to call. So when I left my father's house, I called him back an hour later, and he said it came back, and he went in the garage, got a broom, and hit him on the head, and he ran away. So I emailed the chief, and he said,
hit the bear on the head?
Yeah.
Damn.
I said, "What's wrong with you?" Well, it was on the other side. Yeah, it was pretty big. He was probably a 300-400 pound bear. It was bigger than me.
Whoa.
And so I emailed the chief, and I said, "Well, he came back." We said, "Well, don't feed the bears." My father left a 5-gallon bucket of bird seed out there, and he found it. So that's the message out in South Kensington. There's a pretty big bear out there right now.
Oh, wow.
You call it DEEP.
Yeah.
They have a bear unit.
I didn't see any tags on them either. So
it's a standard problem for where I live. They in the backyard frequently. So yeah, you call DEP. They'd like to know anywhere because they keep statistics on bears and where they're located. We have had when you did the project on Tollgate Road, the workers who were doing that, when they went down the stream to look for sampling points and things, my understanding is they came back at a rather rapid pace with a bear behind them.
Oh my gosh.
Well, I'll tell you, this one wasn't afraid because I came out my father's back of his house to get in the back of the garage, and I made some noise, and it looked at me, laid down on the ground, and kept eating. So he wasn't afraid.
He was hungry. What the heck, you know?
He's ready to hibernate.
He really hit him.
Yeah. What's wrong with you? Yeah, he was on the other side of the pool fence, so he just reached over and whacked him, and he ran away.
That's pretty funny. Pretty scary, too.
Yeah.
Blew up on the insurance.
Yeah. Okay, any other comments?
Yeah, I'll just very quickly.
Yes, sure.
Sunday night, I had gone out to get some groceries, and I came back to my neighborhood, and I live in over in Stony Mill, and on Berlin Road, there was a raging house fire.
Oh, yeah.
It was
Read about that
it
one, yeah.
was absolutely stunning. It was just terrifying. Thank goodness everybody got out
Nobody
safely.
got hurt, right?
Nobody
No,
got
that's
hurt, and they were in the house when the explosion occurred. But I have to say, I kind of stuck around and watched our rescue personnel, and granted, I know that that's what they're trained to do and what they're paid to do, but they were absolutely fantastic. So shout out to our, our firefighters, our police, and they were just remarkable.
Maybe we have Jim come up because there's actually been 2 fires in the last week. So maybe Jim can come up and just address those.
I mean, I did have a question on that. I know certainly the one. Got hurt, right? That the explosion, yeah. I read it in the paper, but I was curious.
It was on Berlin Road. We live pretty far from, not far, but like a quarter of a mile. And my son heard the explosion, and he said it was just.
Wow.
So since Thanksgiving, we've had 4 house fires in town.
Wow. Oh my heavens.
With the latest one being over in East Berlin area. The last 2 were bigger fires.
Really?
Up on Parish Drive. We had one Friday. Somewhere around noon, which left the house so that they couldn't live in it. And of course, the one in East Berlin, they can't live in that house right now. We did have one firefighter get a little burn on his shoulder when they were pushing in. But everybody did their job. People got out of the house. Firemen went home safe.
That's the way it needs to be. Now, what
Do you think it's-
the cause of?
Actually, they've all been different causes. The one in East Berlin, they're still investigating.
Figuring out.
It's up to the fire marshal's office to do the investigation. So between them and the insurance companies now, they do that pretty thorough. But let's see, one was electrical, one was fireplace, not properly built. One was they were working on some pipes and caused a fire. And the last one is that they're working right now to figure it out.
To see what it is. Wow.
They made a pretty good stop on Paris Drive, though.
A very nice stop.
That was going pretty good. It's right my
Wow.
our
Yeah,
own
right,
neighborhood.
right.
And
right,
I
yeah.
saw the flames. I said, "Uh-oh!" Right? They did
Wow.
pretty good over there.
They actually Friday morning, which was 7 degrees outside. Friday morning, we had a crew in Newington at the training tower doing their live burns. So they were out in the freezing cold to start off with, and they were coming home when the calls actually happened. Thank God they were coming home, because otherwise we've been strapped with a little less manpower. But they made a great stop there. The stop in East Berlin was a great stop there. They do a hell of a job.
Yep.
There's no doubt about it.
And the social services helps these people. We
Yeah,
locate them after the fire, and the Red Cross stepped in also and has helped relocate the people.
Yeah.
Oh, that's good.
Yeah.
Oh, it's too bad this time of year, huh? It's,
Yeah,
horrible.
it
It's
always
not good any
happens this
time of year.
year.
It's horrible, yeah. Well, thank you.
Yeah.
Thank you.
Thank you.
And certainly thanks to our fire departments for being there. Anything else? Okay, so we'll just do one last piece of business, acceptance of our minutes on December 5th, 2017 for
Okay.
meeting.
Motion to accept the meeting minutes from December 5th, 2017.
Second on that?
Second.
Any discussion? All those in favor?
Aye.
Aye.
Opposed? So moved. Thank you. Motion to adjourn.
So moved.
So moved.
Second.
Everybody in favor?
Aye.
That's aye. All right. So
Merry
so
Christmas,
moved.
everybody.
Yeah. Merry Christmas.
Merry
Happy
Christmas.
New Year.
Happy New Year.